Infertility, recurrent miscarriages, pregnancy complications, as well as postpartum fatigue are some of the challenging issues facing women afflicted with adrenal fatigue syndrome. The more severe the adrenal fatigue is, the more chances of risk in these areas that you will encounter. Now, infertility is probably the most challenging for most, even in the milder stages of adrenal fatigue. Symptoms start with endometriosis, PCOS, PMS, fibrocystic breast disease, fibroids from time to time, or even breast cancer. These are alert signs to the woman that the body is in trouble hormonally, but also because much of this regulation falls to the adrenal system, we have to start paying attention to your adrenal glands very, very early on. And I will teach you how to recognize those in my video on this topic. If you are able to get pregnant, but you also have symptoms of recurrent miscarriages, especially during the first trimester, this is another warning sign. Many are able to get pregnant, especially if they are young, but if they are in the advanced stages of adrenal fatigue, they find that they have recurrent miscarriages, especially during the later part of first trimester. This is another warning sign that the body is in trouble, and the reason is most likely tied to progesterone deficiency during the adrenal fatigue stage. We will need to go through that as well, and how to prevent that, what to look out for, how to alert your doctor so you don't go through the trouble of getting pregnant only to lose the child. Now, for some that are fortunate enough to pass through the first two hurdles, then how to maintain an uncomplicated and uneventful and pleasant pregnancy becomes the third challenge. During pregnancy, the body oftentimes goes into a mode where it is trying to reserve all its energy for the fetus, and if the reserve level is not sufficient, the drawdown on the body's reserve can pose a significant problem as the pregnancy advances, and symptoms can include sugar imbalances, fatigue, depression, salt craving, blood pressure irregularities, and others. And we will need to address those if you want to make sure that you don't get into that type of situation. Finally, many women do go through postpartum or after delivery fatigue, depression, and low blood pressure, and these are also significant and advanced warning signs that the body is simply too drained after delivery, and many women report that they're never quite the same. Now, in order to prevent this from happening, we have to try to help the adrenal system well and way early during the pregnancy stage. So for a woman, reproductive dysregulation doesn't have to be very serious, provided that you are on the alert, let your doctor know what to do, and take preventive steps that are natural, non-stimulating, good for the fetus, and good for your body to ensure that your reproductive cycles, not only through your regular menses, but throughout the pregnancy as well as the pro-pregnancy period, is very smooth, very pleasant, and uneventful. This is Dr. Lam, and I hope that you will enjoy this video on reproductive dysregulation and adrenal fatigue syndrome.